Hello, everyone. My name is Lisa Zimmer, and I am a prevention specialist with the Southwest Council. And today I have a special guest with us. Her name is Dr. Leslie Smith, and we're going to be talking about caregivers and how important self-care is. So, Dr. Leslie, can you first just give a little bit of information about yourself and who you are?
Good afternoon, Lisa. It's nice to talk with you. I wish we were in person, but that can't always be. So it's good to talk with you. Um, I am a doctor of clinical psychology today, and I am a professor at Rosemont College, and I teach in the graduate psychology program. But I came to this in a long and windy road. I have previously worked in business for years and years as a management consultant, just advising organizations on and people on how to better perform. And then I was very interested and have always been very interested in women and children's issues. And I entered into the world of caring for and sheltering women and families that were experiencing domestic violence. And I ran a couple of those organizations, and then I moved on and was very interested in really much more of a formal process, and went on to get my law degree and practiced in the arena of caring for children that were victims of domestic violence and sexual trauma. And I liked the world that I was operating in with those kinds of clients. And I went on then to get my doctorate in clinical psychology. So that's the long and winding road as to where I am today.
All of the many accomplishments that you have reached and all of the people that you have helped. So with this topic, I want to first talk a little bit about caregivers, and then we'll get into self-care. When you think about a caregiver, the easy definition would be, well, one person who takes care of another. Is that kind of the definition that you see? And what types of caregivers are there?
Yeah, I would definitely say like the idea of like one person taking care of another. But that care comes in just a variety of ways. It's like, what kind of care? Are you caring for the person on a medical level? Are you caring for the person on an emotional level? Are you caring for the person on both levels? Are you responsible for the medical, the emotional, the financial? Just what is the level of responsibility and what is the care that one is giving? And what is the relationship in providing that care? And yes, you said, asked, what kinds of caregivers are there? Oh, there's obviously there are people that give care for a living. They are coming into people's homes and providing care and assistance, nursing assistance. There's obviously the medical and professional community that are providing medical care. There's social workers and folks that are doing the kind of work that you're doing that provide care. And I guess the ultimate caregiver of all, if they do it well, are parents providing care, grandparents providing care for children. So all different kinds of caregiving.
What do you think, is the mental and emotional difference between kind of being a caregiver by profession and being a caregiver to a loved one? Because I know that there's kind of different aspects to both of those roles, and not that one is necessarily easier or harder. I know that they're just different, but how does from a mental and emotional standpoint, how are they different?
I think they are so decidedly different. I think that those of us that select into a profession of caregiving. By nature and temperament and maybe our own early histories, we want to have individuals experience perhaps something that we didn't get to experience, or experience love and compassion in a different way through a system that may not be all that loving and compassionate. Providing caregiving for a loved one is extraordinarily challenging, many, many, many times overwhelming, and many times just experiencing in real time a grieving process.
Mm-hmm.
So it makes it much, much, much more complicated providing care for a loved one that may in fact be medically compromised, health compromised, I should say, whether it be emotionally compromised or medically compromised.
Mm-hmm.
So it's very, very, very challenging.
Yeah, I was just, thinking about that difference. And the one, being a caregiver by profession, I mean, you always have a choice, right, in everything that you do. But, sometimes it's kind of, you know, we have a calling to be someone that provides care or to help somebody. And then sometimes you're kind of just put into that role if it's a loved one, right? Unexpected circumstances that kind of changes your life from one direction. And then, so even though everyone has a choice about what they're doing, I feel like by profession, it's more of a choice than if you had a loved one who kind of all of a sudden needed care. And then um, there's not really that choice. It's you love that person, and yes, it's a choice to take care of them, but it may not be an expected choice, I guess I should say.
Oh, I agree more. I think that you know, for those of us that that do it professionally, provide care professionally, I believe that we self-select into it, and we have control over it.
Mm-hmm.
We have control over whether or not we want to continue doing it, perhaps in the environment that we're doing it in, or we want to sort of do it differently. We have control over it. And we're also trained to figure out when it feels like it's getting out of control and it feels overwhelming and it provokes all kinds of anxiety.
Yes.
We have all kinds of training that, and folks that we check in with, that allow us to sort of get things back in perspective.
Yeah.
When it's a loved one, we generally don't have any control. I mean, what is happening to that individual is happening to that individual. And maybe if on a good day, they can control how it is that they're processing what's happening to them. Most of the time, not. And then certainly as a caregiver, you're one step, removed from what is happening to them, and we have even less control. So that is really, really overwhelming, and most of the time very anxiety producing.
Yeah, and we'll talk a little bit more about what's kind of the best way to handle that. But one of the things I was thinking about, so for my organization and for the type of work that I do, we have support groups where many different agencies come together, and it is support for those, kind of in this field. And it's a round robin, and we all kind of talk about our days in a way that's like, a safe environment for us to vent. But you're right, when you're just an individual and you're caring for a loved one, you may have somebody that's going through that same situation, but you might not, and I think that makes it really difficult. What would you say, again, from an emotional standpoint, from both sides, both professional or caring for a loved one, is the most difficult part? What do you think is like kind of the most impactful and a part that individuals really struggle with as a caregiver?
I think it's what you alluded to in terms of control. We, as I think as a caregiver to a loved one who may be in home or who may be having all kinds of multiple system breakdowns, all kinds of different, medical interventions, that just not knowing, not being familiar with, the management of conditions or like the disease that one might have is one overwhelming thing if you're providing care to someone and you don't really know or understand in great depth about what the problem is, let alone the individual who's experiencing the medical or who you're providing care to. They may not understand or have full awareness of what the problem is. So just having no control and being emotionally so attached to the individual. And emotions can run the gamut. Maybe you are emotionally attached to the individual, but maybe that emotional attachment hasn't been a healthy emotional attachment. Maybe the emotional attachment has been the best and the most like wonderful attachment that there is. And both of those bring all kinds of complexities, emotional complexities to the caregiver. I think that one of the reasons that people opt to do caregiving as a profession is that that emotional attachment isn't there, which allows them to have some perspective on and some self-care on how to provide care. When you are emotionally attached, when you are in a relationship with the person who needs care, there is no perspective, so to speak. And one can be fully engaged in the emotional aspect of it and needing to be more detached from the emotional aspect so you can provide the best care possible and it not be a wear and tear on the caregiver.
Hmm. Yeah, and I think one of the things that's important that you pointed out is the control, because I know, from my experience, a lot of your happiness can often be surrounded by the unpredictability of, the person that you're caring for. So it almost takes some of that out of your hands, where one day the person that you're caring for may have a really wonderful day and you have a really wonderful day, but the next day something kind of pops up, especially when we get into long-term illnesses or progressive deterioration of illnesses, and you don't know what to expect, and things often pop up. So I think the unpredictability of that, I know for me, was difficult. And then the other thing that you mentioned that was difficult is when you have somebody that you're caring for and they have a particular condition that as of the day before you knew absolutely nothing about, and a couple of months later you are now the spokesperson because you have had to learn so much about what that person is going through in order to help. It mentioned before, when I was caring for my father, I didn't really know much about COPD and breathing issues, and by the time he passed, I feel like I could get anyone through what he had gone through, because you do get so ingrained and enmeshed. And as a caregiver, you need to, because you're going to appointments, you're taking people to appointments, you're so involved. So I think that was interesting. But on the flip side, what are some really wonderful things about being a caregiver?
If one can maintain a here and now perspective, I mean, we talk so much, at least I talk so much about sort of the world of mindfulness, sort of being present in the moment and understanding that this is what I'm doing right here and now, and maintaining a perspective that I'm going to do just this right now, and I'm not going to involve myself in concerns about what happens next, because the moment I'm worrying about what happens next, then I'm out of this moment now. And most likely, some level of anxiety is
I
going to
was going to
take
say,
over.
Dr. Smith, that is incredibly difficult to do for anybody to not always be thinking about the next thing. Um,
Mhm.
so so yes, I would imagine that's good. However, it is difficult to do. Um, I think one of the, you and I personally have talked about all of the difficulties of being a caregiver, but one of the positive things also um, was for me that I was there for my father, and everything that kind of needed to be said was said. Now, in his particular situation, he, mentally, for most of the time that I was caring for him, was just emotionally available and mentally available. So I was able to, close a lot of things, but have that time. So that caregiver time for me was really us getting to know each other really well, which was incredibly positive. Us making sure there was nothing that was left unsaid. There's no regrets. So I think that when you're caring for a loved one, the positivity of that is knowing that you've done everything that you know that you could have for that person, and getting to know them maybe in a way that you never had before in your life. And so of course, yes, that it may make it more difficult when they pass, but I'm going to be honest, I think it made it easier, you know, because I didn't have any questions, because I was able to share all those things. He really did know how much I loved him, because we had that time for that conversation. So for me, that probably is the biggest benefit. I'm not sure from a professional standpoint. I mean, when you care for someone, I know for me, when I'm working with a client and they're either in recovery or they're actively using substances and they're interested in stopping, you know, obviously the joy would be, making positive decisions and seeing, that person grow. Um, and when you have somebody who is deteriorating and that ultimately may be hospice and then pass, even as a professional, knowing that they're not alone when those things happen, and that they were given the best care. So I think those are the benefits, even though there's so many difficult things. Is there anything that I forgot?
Um, no, I think that my experience is that as someone nears the end, whether it's professionally or a loved one, they do not want to be a burden.
Mm.
So, to the degree as either professionally, if someone's in a time of crisis and they're deteriorating, or as a loved one, if someone is deteriorating or declining, um, conveying whether you're washing their face off or whether they're demanding a particular kind of meal, or whether you're assisting them to stand up or sit down, that as long as you can maintain the perspective, which is why the here and now is difficult, but as long as you can maintain the perspective that the last thing that I can have this individual feel is that they are a burden.
Mhm.
And to the degree that we can lift that for them, their decline or even their passing, they're just much more free to experience what they need to experience. It's really hard.
How can you do that? Like how would you suggest that somebody tries to make the individual feel that? How do you do
It
that?
is really about maintaining the perspective of just the task at hand. It's that I have to, this is what is needed right now, whether it's something teeny, teeny small or very challenging and difficult. You know, if a person is partner's having trouble walking, it's how am I going to get them from the chair, from the chair to a standing position, knowing that it may be hard for me. I may have something else to do, knowing that they're heavy, or knowing that they haven't been doing the exercises that they're supposed to do to make them feel better. It's knowing that they didn't want this, certainly way more than I didn't want this.
Mm-hmm.
So it's understanding that this particular task is temporary. This particular thing of having them stand up is just temporary. I may have to do it, 60 more times, but this one right now is temporary. So I'm going to take the time necessary to just do this task at hand. And it makes things just a lot easier if you can just be focused on the task at hand.
Mm-hmm.
Challenging,
Yeah.
but
Yes. And so we've already talked a little bit about how things can certainly be stressful, right? We can be stressful at work, we can be stressed at home. I mean, we're all really stressed, aren't we? I mean, I don't think I've ever met somebody that was like, "No, I don't have any stress in my life." And if somebody who is listening feels that way, please shoot me an email and just tell me how you've accomplished it, because it would be really helpful for me to know. Um, so let's dive a little bit into self-care. So what is self-care? What kind of different subsets of that are there, right? So we've got like physical self-care, we have emotional self-care, that type of thing. Um, what would your general definition be
of self-care,
of self-care?
um,
And the reason why
having,
I'm asking, Dr. Smith, real quick, the reason why I'm asking, some people say, oh, I have a hobby of doing that. Now, that hobby could be self-care for them, but doesn't always necessarily mean, well, when I go fishing, and I'm sitting out there and the water's beautiful and I'm listening to the birds and I can really get to that place to be centered. Or it can be like, I go fishing and I got to get the boat and I have to make sure I have the things, and like that produces stress, right? So, I think there is a difference between a hobby and doing things that are self-caring, although they can be the same. Does that make sense?
correct,
Okay.
absolutely. Um, to your question of how do I define self-care? Well, the average individual has between 60,000 and 80,000 thoughts a day. So, does anybody wonder why it is that we are in a heightened state of, whoa, 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 all over the place? So it's really hard to quiet our thoughts. So self-care is the awareness that there's certain things that are going on in my life that are likely to require a whole lot of attention, and that it may be triggering for me to provide that much attention to a particular kind of thing. So self-care is awareness of that this thing is a stressful thing that I'm doing, and I need to be conscious that this is a very stressful thing for me, and I need to begin to figure out ways of how to manage my anxiety. Stress is just a different way of saying anxiety.
Mm-hmm.
And, and to what degree does this particular caregiving event provide anxiety. Anxiety is another word for fear.
Mm.
So we have stress, we have anxiety, but when we break that down, it's really fear. And Lord knows, as a caregiver, especially of a loved one, there's tremendous fear involved, just for the reasons that we've stated earlier. So there's a lot of fear. So it's being aware that this event may be really fear provoking, and just being cognizant that, yeah, it is scary and I'm not sure what I'm doing and I don't necessarily know how to do it. Just being cognizant that we don't know what we're doing, and that's scary, particularly because we may be the sole source of doing for another human being. And we haven't been in exactly that place before. So awareness of what it is that we're doing.
And so, why do you think it is so important for self-care of a caregiver? I mean, we all need stuff. We all need to take care of ourselves, right? We all need to have that awareness and come to that place, right? But specifically for those that are taking so much of who they are and kind of giving it to another person,
Mhm.
you know, why is it just so important to remember, to care about yourself also? And why as humans is that so hard for us?
Right. Yeah. I mean, many of us have been in caregiving roles, in multiple caregiving roles over the course of our life. If we've raised children, if we are our grandchildren, if we are working in the field, like, we provide care and we know how to do that. But we don't necessarily know how to provide the kind of care that we're asked to provide for a loved one that might be in decline. So it's so anxiety producing to do that. And if we allow that anxiety to get out of control, we get pretty depleted. When we get pretty depleted, we get pretty unuseful. Or we get cranky, angry, frustrated, guilt ridden,
Mm-hmm.
shamed that we can't do
Short-tempered. Mm-hmm.
right. Just that, so we have to carve time out for ourselves in a way to release that anxiety. Some people release anxiety through exercise, and I would recommend that everyone take at least 20 minutes a day to do something that is going to release some kind of energy physically from one's body. Taking a moment to, like, to do something that is truly pleasurable. If it's watching 15 minutes of your favorite show on television, if it's reading a book, if it's taking time out to, like, complete a task. Many caregivers, our task is never ending. It's that we are constantly on duty. So doing something that has a start and a finish,
Mm-hmm.
and it looks like it's a completed project. It's like, it could be something as simple as making your bed.
Mm-hmm.
It's like, wow, I did that and now it's done and it looks really good.
Mm-hmm.
Something pleasurable as, like, doing the laundry, doing a load of laundry, putting it in, shifting it over to the dryer,
Right. In the same
folding it
day,
up.
like doing it,
And
not like doing
yeah,
your wash,
in this
finding it the next day, washing it again,
smell,
then.
right, right, smelly, because you didn't have time to. It's like
Mm-hmm.
just carving out the ability to complete something and recognize that the world of caregiving is incredibly incomplete. It's never ending. And sometimes doing something that has a start and a finish is just very rewarding. Um, so there's many different kinds of ways. Picking up the phone and talking to another caregiver, somebody else, doing something for someone else other than the person that you're giving care to.
Mm-hmm.
knowing that somebody else has an errand that they want run. Just getting outside of your own space
Mm-hmm.
sometimes gives great relief to those, because as a caregiver, you are so locked in to not only the needs of the person you're providing care to, but in the needs of all of the things that you have to keep together while providing that care. So it's an arduous job, but carving out, even if it's like, I don't have 20 minutes. Okay, this is what I'd say. How about you do 1 minute? Start
Mm-hmm.
out with baby steps, just teensy, teensy baby steps. You can't have a half an hour to yourself. Great, take a minute. See what
Mm-hmm.
that looks like. Take a minute. Take a minute and go and breathe in
Mm-hmm.
to the count of 4, hold it for the count of 7, and release it to the count of 8. Just 3 times. And that
Yeah.
may give you relief.
I know for individuals that are really kind of, tech savvy and are always on their phones, they have so many wonderful apps. Even my Fitbit that I wear,
Mhm.
just to monitor my exercise, has a breathing button on it. Like I press it and it vibrates when it tells me to breathe in, it vibrates when it tells me to breathe out. And it even has like these little dotted circles that kind of open and close. So visually, and that
Mhm.
1 minute, it's amazing how much of a difference that can actually make. Um,
Right.
so so yeah, I would suggest that to everyone. Um,
Yes, breathing is enormously healthy,
mhm,
and it gives us a perspective. You can't be panicking if you're breathing,
mhm,
especially rhythmically. If you're breathing in 2, 3, 4, hold 4, 5, 6, 7, and breathing out 8, 9, 10, 11, 12. It's, you can't be panicking
mhm.
if you're doing it like rhythmically.
And it's really a learning experience. And I remember when I first started, sounds so silly, but like trying to breathe, you know, I realized how wrong I was breathing. I literally rushed to do everything, and I'm like rushing my breathing. And so when I would either listen to meditation or breathing, I would like get bored, like, okay, can we like speed this up? And then it's like, well, that's the point. Like you've got to slow it down. So it is really helpful. Um, when it,
Other thought measures like that you're talking about, other things to like get you, listen, we think all the time. And
Mhm,
most of us, especially if you're in the caregiving mode, you're thinking negatively. What's going to happen next? What's going to happen next? What if this happens? What if that happens? Allow yourself to talk to yourself,
mhm,
like literally, like, I'm so worried about, I'm not going to be able to do that. Saying to yourself, it's okay if I don't do that. I don't know how to do that. I'll learn how to do that. But
mhm,
you really don't know how to do it. Well, okay. I'm gonna learn how to do it. Just countering the negativity with a positive, more rational thought, because we can get so overwhelmed and so afraid
mhm,
that it's just not going to work out the way it's supposed to work out.
mhm. In
Thoughts.
in in what ways? So I had mentioned before about how there are groups as professional caregivers where we can get together and basically
Yeah.
just vent, right? Like just share what we're feeling. And I do have like some of those people in my life where I can just know that I can vent. Like me and my brother have this agreement where I'll text him and I'll say, "Do you have the emotional availability to have me vent to you right now?" And then he'll say, "Yes, I do," or "I'm having a bad day, check on tomorrow," so that you kind of also respect somebody else's, craziness. So I think that venting is important. But you mentioned about being overwhelmed, and I think that that's probably kind of like the main feeling when all of those thoughts are going around in our head, is difficult to deal with. What can a person do Or I should say, when do they get to a point where they just need help? Either they need help with the tasks that they're doing, whether they need some emotional and mental support for therapy. When somebody gets to kind of those feelings where like, I just can't do this anymore, like, what is your recommendation, and what can they do? Kind of what resources are available for them?
Um, I think that uh, there are numerous, like, I'm gonna say hotlines, but there
Hmm.
are numerous
Like
like
support,
line like
no, support lines.
lines to
Yeah.
talk to, because I think what you're saying is like people, they do need to vent. Listen, people don't need anyone to fix their situation because it's unfixable. Like nobody is going to say, "Well, why don't you just cook yourself a good meal?" Okay, are you kidding me? Like you're not looking for anyone to fix the situation. You're just looking for someone to hear your suffering.
Hmm.
That's all. Like I'm suffering. So you're looking for someone out there who has suffered. Now, we all suffer. We don't can't get off this planet without suffering.
Hmm.
But you're just wanting someone to hear you, to listen to you. And it's usually not a friend or another family member, because the minute you say, I'm just feeling completely overwhelmed, I don't know what to do, they're like, yeah, my day's been really bad too. That's not what you're looking for. You're looking for, and that's why I think having helplines, lines that are available, there's lots of, in magazines, in ARP, in other, like, just assistance lines that people can just call and say, I'm just really out of my wits end and I need someone to vent to. And it's like, okay, go ahead, I got 10 minutes, vent
Hmm.
away. So it is just the ability to reach out. And people don't know what to say when they believe they're asking for help, but they're not really asking for
Yeah.
help. They're asking to just release this just sense of being overwhelmed and fearful. So it's like, I need 10 minutes to just put it out there, and they don't know how to put it out there or to ask that. And it's just that simple. I need 10 minutes to just put out there what I'm going through. And
Mm.
that's it. Just say that.
Yeah, and I think also, especially if you are caring for a loved one and that is a new situation for you, or something that doesn't, feel real natural at the moment. I do think that, finding a therapist, having somebody that you can help to adjust kind of this new state of life is also very helpful. And someone to also continue to monitor and make sure that you are taking care of yourself while you are taking care of another person, um, I think is really helpful. So we've talked about caregivers and self-care. And then I want to talk just a little bit about when you're in a situation as a caregiver for a loved one. So here at the Southwest Council, our mission is to reduce the prevalence of substance use disorder. And we do that through prevention, education, and counseling treatment as well. Um, my role within the organization is to be working with the older adult populations. So, a lot of times I am speaking with people who have a caregiver, um, or people that have a partner, who they are helping to care for. When you have somebody that is um, physically compromised, ill, they take oftentimes many, many different medications. And it's really important to make sure that they have a good understanding of what is being given, what is being taken. We talk a lot at the Southwest Council about accounting for your medication, securing them properly, and then disposing of them. So you had mentioned earlier about sometimes when you are a caregiver to a loved one, that's not something that you've ever done before. This is all new information. So how important is it for that caregiver to kind of get a firm understanding of all of those, possible risk factors of substance use, in addition to just medication safety, and making sure that they're caring for their loved one, and being aware of those medication needs?
Medication needs as part of like the, well, Lord knows with some diseases and declining positions,
Mm.
there's tons of pain
Yes.
that is associated with
Unimaginable pain
decline,
for sure.
and the use of opioids and pain management medication, we'll put that in quotes, um, is has been historically quite available.
Mhm.
And and there's I often say that um, pain is real. The management of it is psychological.
Mm.
And when one is in decline and experiencing not only pain, but also the loss that goes along with physical decline, the
Mm.
loss of grieving one's life, that may be grieving one's relationships,
Mhm. Loss of
grieving,
independence.
right, loss of independence and
Mm.
dependency. The idea to use pain management medication, not only to escape the pain, which is inescapable, quite honestly, but also to escape the mental pain, becomes very attractive.
Sure.
And understandably so, but very
Mhm.
attractive. Very attractive not only for the person we're providing care to, patient, but also for the caregiver.
Mhm.
I mean, everybody is wanting to numb the psychological pain that goes along with decline. So, being incredibly conscious of not only the physical side of things, which pain medication can only do but so much because the pain's going to be there,
Yeah.
that getting folks able to come to a place of this loss and the world of loss that they're embarking upon is probably the most important aspect of it. So we want them to use
Mhm.
medication prudently and wisely. And people aren't necessarily in the frame of mind that they're able to do that based on their own judgment. And
Mhm.
that's why the caregiver becomes even more important, because we don't want people medicating their conscious state, because we want them to actually be able to live and experience, like in current time, what's really happening with them, and love and connection, and that which becomes so important in end stages.
Wow, well, that's pretty much the most wonderful answer ever. Thank you. Um, is there anything else that, that combination of self-care and being a caregiver that that you want to talk about or speak on, or any questions that you think are um, that are missing, that's important for people to know as they kind of delve into this relationship?
I would only say is that just human beings in general, we don't know how to ask for help. We don't have a language for asking for help. So I would just, as a caregiver, I would like from the get go of when the caregiving starts, get acquainted with, I need some help. Look in the mirror and say it if you've never said it before. I need some help. Find a language, whatever it is. If you don't like the word help, I need some attention. I need whatever words you want to use, but come up with a sentence that lets folks know that you need help, because you have to be able to ask for help, or it's going to be a really, really, really arduous journey. And there's no
And
need
lonely and lonely.
and lonely, extraordinarily lonely.
Yeah. Wonderful. Thank you so much for coming and speaking to everybody today. I personally appreciate it so much. And I know that the people listening are going to get an awful lot out of what you had to say. So thank you so much for coming on and talking today.
Thank you so much for inviting me.
All right. Have a great day.
You too. Bye-bye.